This lesson will cover how to conduct a medication review and manage medications. The objectives for the lesson are to understand the problem of medication polypharmacy, to describe how RNs conduct a medication review, and to identify when to collaborate with the PCP to modify the medication regimen. The medication problem in the My Choice program is that participants are either older or disabled and take a lot of medications. On average, they take 7 medications, but that ranges from 0 to 48 medications per participant. And in addition to that, on average, 5 different doctors prescribe the medications for participants in My Choice. Currently, RNs list the medications. Some participants receive help with medication setup, and a few participants receive education on medication information and review. So we know the medications to avoid in the elderly are not always implemented in My Choice. So polypharmacy is defined as the simultaneous use of multiple drugs by a participant for one or more condition, or the use of 4 or more medications. Polypharmacy is most common in the elderly. About 40% of older adults experience polypharmacy, and about 21% of disabled adults have polypharmacy. However, the problem is much larger in the My Choice program, with 95% of participants having polypharmacy. So multiple medications can cause harm. Increased falls, delirium, dehydration, constipation, and bleeding, just to name a few. Here's our first checkpoint, true or false. Polypharmacy is the simultaneous use of multiple drugs by a single participant. The correct answer is true. Polypharmacy is the simultaneous use of multiple drugs. To combat the problem of polypharmacy, current evidence-based practice is to use the Beers criteria, which is a list of clinically important medication interactions that should be avoided in adults that are over 50 years old. We've also provided you some reading material about the Beers criteria and a pocket card to download and print for your use. But in brief, here's an overview of what the Beers criteria are like. There are multiple medication classes that are included. ACE inhibitors, anticholinergics, antidepressants, antipsychotics, benzodiazepines, and corticosteroids, oral or parenteral. And what class of medication most commonly interacts with that medication and what the risks are in the other 2 columns on this slide. Here are some more medication classes that are included in the Beers criteria. Lithium, opioid receptor agonist analgesics, peripheral alpha-1 blockers, theophylline, and warfarin. And so this slide also has the common medications that are interacted with these medications and the risk to the participant. So here's another checkpoint. What is the name of the criteria that lists important drug-to-drug interactions that should be avoided in older adults? Is it Smith's, Boston, or Beers? The correct answer is Beers. So one evidence-based solution to combat polypharmacy is medication review and management. Here we describe the difference between medication review and management. A review is an assessment of a participant's complete list of medications taken or to be taken, prescribed by physicians over the counter, including herbals and vitamins. The RN examines medications to monitor potential medication to medication interactions or contraindications, sometimes, but not always. Whereas medication management is monitoring the medication to make sure they are taken properly, confirmation of adherence to the regimen and refilling of scripts, ensuring avoidance of potential drug interactions, and teaching the participant and/or caregiver to manage the medications independently. Here's another checkpoint, true or false. It is important to conduct both medication review, which is making a list, and medication management, which is understanding the purpose and taking of the medication at the right time and dose. The correct answer to this is true. Participants need to know both of these pieces of information. Here's a rule of thumb regarding when, what, and how to do a medication review. You should review the medication when you're completing an initial face-to-face RN session, if possible. Here's what you review. You ask questions and seek answers to the medication list. You provide information to the participant. You examine therapeutic duplication, medications without indications, medication allergies or intolerance, medication to medication or medication nutrient or medication disease interactions, inappropriate medication selection, suboptimal medication regimens, adherence issues, and financial concerns. And document that in the record. The name of the drug, dose, indication, taken or not taken, or improperly taken. So then you conduct a review using either the Epocrates or Medscape apps. We'll cover those in a future lesson. As a rule of thumb, you conduct a medication review on all participants and then manage the medications when they have over 7 medications they're taking, if they're at risk of falls, if they have certain medication classifications such as diabetes, heart, or cancer medications, and they're taking medications on the beer list. Medication review and management should be completed on the initial RN face-to-face home visit and done when a new medication is taken. We can learn the following from a medication review. Is the information on the medication list correct? Does the participant understand the correct medication dose, time, and reason taking? Is medication adherence occurring? Are there contraindicated medications, interactions, or duplicates? And are changes needed to the medication list? Then follow up on medication interactions or the next step. What happens to a medication in the body is called pharmacokinetics. It's affected by prior administration or co-administration with another medication. So that could be medication to medication, medication to food, or medication to disease interactions that are contraindicated. Medication to medication interaction review is critical for participants who are on multiple medications. And there are several types of interactions that you can find when doing a medication to medication review. One is avoid use alternative. So the interaction may not be life-threatening and require intervention to minimize serious adverse effects. Another one is monitor and modify treatment. That interaction may result in an exacerbation of the condition and may require alteration in the medication. And the third is caution advised. The interaction would have limited clinical effect and generally does not require alteration in therapy. So the tool we most commonly use to review medications is Epocrates. It's an app. Another lesson will cover how to use this. So here's what the RN should do if you find a problem. For the avoid or use alternative medication or where the adverse event or duplicate medications, use your judgment. Use critical thinking to determine if it's a problem or not. If critical, contact the PCP or specialist while in the home by phone. If it's not critical, contact them by fax or email or leave a message. For the monitor-modify treatment problem, use your judgment. Determine if the participant and or their caregiver can follow up. If able, the participant contacts the PCP or reviews the problem on the next appointment. Or if not, they contact the physician when they're able by phone and leave a message. And for those that are caution-advised medication problems, use your judgment and determine if the participant can follow up. Here's an idea that many clinicians use when they provide in-home type care to prevent drug interactions. They ask the participant to carry the medication list at all times so that it can be used in the emergency department, when hospitalized, and at doctor's appointments. They need to keep their medication list updated and bring all their medications to PCP appointments. If they're seeing a specialist, ask the participant to request a review of medications prior to taking a new one prescribed by the specialist to assure no contraindications are found. And here are a few evidence-based medication management tips. Obtain participant buy-in. Share stories to explain how to do things at home, like in twice a day morning and night doses, and use teach back what is said from you to the participant and then from the participant back to you so that you assure they have an understanding of what to do. Get through to the participant the importance of the medication. And then evaluate adherence. Ask the participant when they're going to insert the medication into their daily regimen and how. Are they going to do it by sitting it by their toothbrush in the morning if they have to take a morning pill, or by their meals if they're supposed to take it when they eat? Also, identify barriers to adherence, such as inability to read a label or poor understanding of their medical problems, or if they have a memory problem. It does help to provide a medication list or calendar for them to write their medications on that they can then cross out after the pill is taken. And while reviewing medications, educate the participant and their caregiver about the purpose of the medication, the side effect, and the regimen. In summary, as a licensed professional, it is the duty of an RN to conduct a medication review and assist the participant to manage their medications. This can be accomplished by the RN by understanding polypharmacy and applying the Beers criteria to all participants, conducting a medication review using evidence-based techniques like use of the Hippocrates or Medscape apps, and then taking action to correct polypharmacy or having the participant follow up with a provider, the PCP, or the specialist on their next visit when not critical. And most importantly, to prevent risks like a fall to all participants when possible by reviewing and managing medications effectively. Thank you.